Hello everyone, my name is Rohan Thapar and today I will be presenting on suicide as a mental health issue. Suicide is a very serious topic that affects individuals, families and communities all over Australia. It is not just a personal problem, it has long-lasting effects on friends, workplace and society as a whole. During this presentation, I will explain that what suicide is, how it impacts Australia, the main risk factors, available treatments, how trauma interacts with suicide, and finally, my reflections on this topic. Understanding suicide. Suicide happens when a person intentionally ends their own life. It is a complex mental health problem that can be influenced by emotional pain, mental illness, stress, or life challenges. Many people who think about suicide feel hopeless or trapped and may believe there is no other way to cope with their problems. Suicide affects families, communities very deeply. Loved ones often feel grief, confusion, and guilt, and these effects can last for years. Understanding suicide is first step toward prevention and support for those at risk. Suicide in Australia. In Australia, suicide is a major health concern. Thousands of Australians die by suicide each year, and it is one of the leading causes of death for people aged 15 to 44. Men are more likely to die by suicide, while women attempt suicide more often. Rates are also higher among Indigenous Australians and in rural or remote communities, often because of isolation and limited access to support services. Organizations like Lifetime and Beyond Blue provides 24-hour support for anyone experiencing suicidal thoughts or crisis. These stats shows that suicide is a problem that affects people across age groups, genders and communities. Risk factors. Suicide risk is influenced by many personal and social factors. Some of the main risks include previous suicide attempt, family history of suicide, mental illness like depression and anxiety, substance use, financial stress, unemployment, and relationship difficulties also increase risk of suicide. Trauma, neglect, or abuse in childhood can make people more vulnerable to suicidal thoughts later in their life. Social isolation, loss of purpose, feeling disconnected from others can make these risks even higher. Understanding these factors help healthcare providers and communities intervene early and provide support. Causes and contributing factors. Suicide usually results from combination of biological, psychological and social factors. Biologically, chemical imbalances in the brain can affect mood, thinking and impulse control. Psychologically, feelings of hopelessness, guilt, being a burden to others often contribute to social thoughts. Social factors such as discrimination, poor support networks, financial hardship, or isolation can make it harder to cope with challenges. Early experiences such as trauma, loss, or repeated stress can make individuals more vulnerable later in life. Suicide is rarely caused by one single factor. It is usually the result of multiple overlapping pressures. Treatment and interventions. There are several ways to help someone experiencing suicidal thoughts. Psychotherapy like cognitive behavioral therapy and dialectical behavior therapy helps people understand negative thoughts, learn coping strategies, and manage emotions and stress. Medication can help treat underlying mental health conditions such as depression, anxiety. Crisis support services provide immediate help for those in danger, at risk, and at risk of suicide. Recovery focused care promotes hope, connection, and sense of purpose, helping people rebuild their lives. Nurses and mental health professionals play a key role in recognizing warning signs and offering compassionate care to prevent suicide. Pros and cons of treatments. Each treatment option has advantages and limitations. Therapy helps people develop coping skills and self awareness, but it requires time and commitment over time. Medication can reduce symptoms, but some people may experience side effects and also some adverse side effects. Hospitalization can provide safety during crises, but it may feel more restrictive for the patient and their families. Community programs and peer support groups can help rebuild connection, long-term recovery, though availability may differ by location. Often a combination of therapy, medication, and community supports provide the best results for preventing suicide. Trauma and suicide. Trauma is strongly linked to increased risk of suicide. People who have experienced abuse, violence, neglect, or other traumatic events often carry deep emotional pain, grief, shame, or self blame. Trauma can affect how people regulate emotions, cope with their stress, manage relationships. Trauma informed care focuses on safety, building trust, and empowerment, rather than just judging the person's emotions. Supporting people with trauma reduces the risk of suicide and encourages long term recovery. Recovery and prevention of suicide. Suicide prevention is possible with early support and interventions. Talking openly about mental health and suicide reduces stigma and encourages people to seek help from others. Building social connections, teaching coping skills, and providing mental health resources are all essential to prevent suicide. Nurses, teachers, and family members play a crucial role in noticing warning signs and offering support. Recovery involves helping people regain hope, resilience, and purpose, even after significant emotional distress. Reflection and summary. Studying suicide and mental health has helped me understand the complexity of this issue. Suicide is rarely caused by one single factor. It is usually a combination of mental health issues, trauma, social pressures, and emotional pain. Trauma informed, person centered care is essential in supporting individuals at risk. Preventing suicide requires empathy, sympathy, awareness, communication, and consistent support from communities and professionals. Every person deserves to be listened to, understood, and given hope for recovery. So, at the end, in conclusion, suicide is a complex and serious mental health issue that affects individuals, families, and communities. Understanding the risk factors, causes, and the role of trauma helps us provide better care than support. Though awareness, early intervention, and compassionate person centered approaches, we can prevent suicide and help people recover from hope, meaning in their lives. As a future health professional, it is our responsibility to listen, support, and act with empathy because every life matters. Thanks.